My life in Thiruvananthapuram Medical College will not be complete without mentioning a few words about surgical gastroenterology and Rajan sir. Even Rajan sir and the Maganaya Ramesh Rajan, Paranya Pinna Samsarikanikkam Patilillo, that's why I came over. My career in Medical College Thiruvananthapuram happened with him in 1983. After my marriage, I studied in Calicut Medical College, but I came over here because I married a man in Thiruvananthapuram Medical College, Surgery Department, Dr. Vimalnath. So, my first appointment as a professional lecturer was in surgical gastroenterology. There, I saw a few wonders happening in Thiruvananthapuram Medical College Department of Gastroenterology. A man, and mostly he was not very talkative in the beginning. I met him in the department. Then very few females were working in surgical side, except Sarina madam and one Elizabeth Leela John madam. That madam is called by her colleagues as very notorious name, which I will not mention here. But she was a very nice woman. And while I was walking with Dr. Rajan, young lady, walking with young Rajan sir, madam stopped in between her rounds and looked at me. Then I thought, why she's looking at me like this? I thought maybe Rajan sir's wife, they are meeting in between rounds. No, she wanted to say something very, some funny comments about the couple walking through the corridors of this Ward 5, where, as Dr. P.A. Thomas sir mentioned, our room was inside side of Ward number 6, surgical gastroenterology room, where he will pull a chair after the rounds and he'll start writing the case sheet. So, as a junior lecturer, I didn't know much detail to write about the case sheets, about the surgical gastroenterology details and post-operative notes. So he will dictate and I will write the notes like that. So then I knew what simple this person is. He's operating, he's like a lion. As Gopaleshan sir mentioned, he will take long hours, and I used to stand on one leg for some time, then I shift my right leg to left leg, and meanwhile I fainted one day, and it is confirmed to be my first pregnancy. This is the first personal note I wanted to mention. Then they were all, it was all going on well, and one fine day, I used to, not as told by the people before me, he used to do surgical gastroenterology, devascularization, portocaval shunts, mesocaval shunts, all forms of gastroenterological procedures, and I was the only assistant that time. I worked with him for 3.5 years, and in between he left from the department for better educational programs of those Ramesh and his brothers from Manipal institution. So that's why we lost a great surgeon from this department to it shifted to Manipal Medical College. Then slowly, before I shifted from surgical gastroenterology, my professor, Dr. Mahadevan, used to come and tease me, why you remain there in surgical gastroenterology? You come to anesthesia department, because he knew that I had applied for anesthesiology post. So later, when I got posting in anesthesia, Rajan sir was telling me he joined opposition. Then I didn't know what is the meaning of this opposition, surgeon and an anesthesia opposition. Then it came to reality when people started fighting each other, surgeon and an anesthetist on the table. I was fed up because I met so many wonderful surgeons in surgical gastroenterology, not only Rajan sir, Chakolel sir, Leela John madam, Ananda Kumar sir I didn't work with. Abdul Kalam was the senior most person, Subhash Chandra sir, then Varki Chako sir, SNB sir. It was an accommodation chair, So I had the privilege of working with all these people during those 3.5 years. But so I didn't find any difficulty in going and working in anesthesia departments because all the procedures were known to me. It actually helped me to take my decisions during my anesthetic procedures, what to be done, when to be done, etc., etc. The names of anesthetic drugs were familiar, so it went on like that, and I shifted from anesthesia, gastroenterology to surgical side, and the story everyone knows. I met these young fellows, Matikoshi and Shubalal, and they took over the baton from me as a professional, from professional to PSC hands, and the story is yours. Thank you.